All right, sweet. Lieutenant Governor Cox, I really appreciate you making the time to sit down and talk to me today. So I wanted to start with just kind of getting your general impression of how Utah is doing right now with respect to COVID-19. Are we doing well? Is everything going poorly?
Well, obviously, this is an incredibly difficult time, and probably, at least collectively, for most of us, the most difficult health and economic crisis that we've seen in our collective lifetimes. And so it's a struggle for so many people, those that are facing a medical crisis, those who may have lost their jobs or have businesses that are struggling. And so we recognize that if we are looking for a silver lining, though, it is that Utah is faring far better than most states and many countries, and we're grateful for so many. That's a result of a significant sacrifice by many people, those who have followed the governor's directive to flatten that curve, and we've certainly seen that happening here in the state of Utah. Something we should all be, I think, proud of. And not only that, but we're again top 5 states when it comes to testing, and we've ramped up our tracing capacity. Our testing capacity continues to expand, and that's really good news for us moving forward and giving us the ability to start to return to some sort of normalcy, although we know we're going to have to figure out how to live with this virus until there are some medical interventions, hopefully sooner rather than later.
I have a few questions about Moab in particular, and then I want to kind of ask you about the state generally. As the state is thinking about so many things with respect to opening businesses, lifting restrictions, allocating funding for different organizations. How do rural communities play into all of that thinking and that planning? Because Moab is in this situation where our economy is fed by tourism, and tourism is a extremely hard hit part of the economy right now. And how does tourism in Moab kind of play into the statewide planning with respect to COVID-19?
Sure. So when we look at the Utah Leads Together plan, which was the initial plan that was launched, we updated it last week to show how those dials could be turned to start to allow economic opportunity to expand. And you're absolutely right. We have certain parts of Utah that are in very distinct and unique situations, Moab being one of those. We in some ways we were pretty fortunate with Moab not to see what we saw in Summit County, where Summit County became one of the hot spots in the country. That was really driven by international travel and travel from New York and Seattle, where we had seen the growth early, and brought it with them, and then spread it throughout the bars and restaurants there, and caused some very significant health issues for a community that at least is more adjacent to the Wasatch Front and able to deal with that a little better. The concern from elected officials in Moab and Grand County in that area is that ICU beds are limited, if non-existent, and the ability, to deal with those any significant outbreak would be hampered and strained, again with the Wasatch Front being 4+ hours away. And so those are the issues that we're looking at on a local level. And it's one thing to say, okay, we can allow some of this economic opportunity to continue. That doesn't mean it magically appears. And right now, travel is just restricted across the globe. Even if Utah had done absolutely nothing in this pandemic, the tourism industry would have been significantly hit because of the lack of travel. The airport right now is seeing a very small fraction of its normal flights in a day and passengers on those flights. And so we recognize that this is going to take some time and be more difficult. So the question is, what can we do in the meantime? Can we allow parks to open locally? The governor has just last week allowed state parks to open back up, but we have to be careful. We're encouraging people to wear masks anytime they're in a public situation, and to stay 6 feet apart when they're out hiking. Could we do that with our federal parks, and but just have them open for citizens of the state of Utah? So we kind of slowly again ramp back up, but we're we're starting to stimulate some of that without introducing major infections from other parts of the country that would just set us back. And what we don't want to do is have a major setback. We're trying to avoid that. We don't want to spike. And so those are the conversations we're having with our federal counterparts. That's their decision on the federal parts. But also, this plan allows for localized differences depending on if there is community spread of the virus versus not, what that looks like, because Utah's not all the same. Rural Utah is very different than downtown Salt Lake City, and we want to recognize those differences and utilize them in a positive way where possible.
I want to ask about HB 3009. This is proposed legislation that is being considered right now in the state legislature that would take away local health officials' authority to make health orders and give it instead to local executives. And in addition, it would also create a situation where the state would basically have the authority to preempt local health orders when they saw fit. So I was just hoping to kind of get your thoughts on that bill. Obviously, the bill sponsor has his own ideas about what that's trying to do, but what do you think is the role of local health officials and the state in making determinations about county and city-specific health restrictions?
Yeah, so that bill, we've had some concerns, and they're working through those concerns, working with counties and the local health departments. I should probably point out that I got my start in local government. I was a city councilman and a mayor, and then a county commissioner, and I actually I was the chair of our local our 6 county health association of the board there, and spent a lot of time with local health and have a real understanding for how important local health is and their ability to make decisions in this. And so what I can tell you is that the governor did have some concerns with that bill and has expressed those concerns with the bill. Ultimately, and there's another bill that takes away the state's authority, where the governor has to notify the legislature ahead of time before taking any emergency action, health-related action concurrent with his emergency declaration and authorities. And we have some concerns about that one as well. One of the things I worry about is the potential to overreact to something that happens every 100 years. This is not a normal thing, and hopefully it's not something we'll see again anytime soon, but we need to be prepared for that. Second of all, there's a reason that historically we have tried to separate, at least at some level, political decisions from health-related decisions. Now, I don't think we can't separate those completely, and we shouldn't separate those completely. That was never the intention. And there are certainly things that need to be taken into account, like the economic situation and the potential health impacts of that. The loss of jobs and loss of income and poverty. There are definitely health outcomes, social isolation, and what it's doing to people's mental health. However, I say all of that to say this: the health decisions that are made, and sometimes have to be made very quickly, are really, really critical. And I think it would be a mistake to completely take that authority away from our local health departments. I think, though, what we have learned through all of this is the need to collaborate better in the decisions that we are making, to make sure that we're talking and that we all know what's happening, because especially in a pandemic, this is very different than if you have a measles outbreak at one school. When it affects everyone in the state, a local health department's decision in one area, we have 13 of them, in one area, can impact the entire state and other health departments. And so I do think that there is a need to better collaborate and have those discussions. And if we can find the sweet spot in that bill, I think the governor would be okay with it, but not taking all of those decisions away and just giving them to elected representatives who are probably more likely to make decisions that could hurt people's lives, because we're not trained, we don't have all of the information, and sometimes political pressure isn't always the right thing to do.
The city relies on tourism for all its economic activity. We have limited beds in our hospital. We have one hospital in the county. So Moab is in this very vulnerable place. Health officials are working with businesses to try to figure out what's the right timing for allowing people to come into the county, where should we be focusing our energy on bringing them from. We don't want to be bringing them from, hotspots. So what sort of help can the state offer to Moab, both in terms of just like, expanding testing, but also economically, what can it do for helping to support a municipality that's going to be, have its budget absolutely wrecked by a total lack of TOT money and sales tax this season?
Yeah, and in fact, I think the latest unemployment numbers I saw had Grand County at the high.
I neglected to mention that. Yep.
Yeah, and that, I think, most of that comes from the seasonality piece, starting in a different place than the rest of the state started. I mean, we had unemployment in many of our counties at 2.3%. Of course, Grand County was higher, but that number should be going down right now as we enter kind of peak seasons, and instead it's going the other direction. So these are really important questions, and questions that we're working through right now. And we're working very closely with the League of Cities and Towns that represents all the municipalities, as well as the Utah Association of Counties, representing all of the counties. We are working through the CARES Act, and we were supposed to have guidance from the Treasury Department 2 weeks ago, and then last Friday. We still don't have it as of today, to understand the parameters around our ability to help with local municipalities and what that looks like. And so over the next couple of weeks, we'll be working closely with the legislature. Now, even though that money's coming from the federal government, the legislature has to apportion the way that money is spent, but we will be taking into account the unique situations that our communities are facing. And again, I would say there probably no county, at least, that is more unique than what you're facing there. Of course, Garfield County also is really, really struggling. Similar situations, and Washington County with Zions, but they have St. George, which again with a big hospital, and it's very different there. And so there will definitely be discussions about that, and then how to use the rainy day fund that the state has. We have the largest rainy day fund in the history of our state. Close to $1 billion that we've been setting aside for a difficult situation like this. Now, a lot of that will go to backfill gaps at the state level, as well as we see those revenues fall off. But we've already implemented emergency procedures as we're moving into a new budget year, to not spend any of that new money that had been allocated, because it's not going to come. We know that, and to start backing up to last year's numbers, using those as a starting point until we can figure out where we are and where the bottom is on this. And so those conversations will be ongoing, and we'll be working very closely with your mayor and county council members to make sure that we're being fair in how we apportion those dollars, and what we can do to help alleviate some of the frustration and pain that you're seeing there.
Where is Moab, or where is Utah headed right now in terms of testing capacity? Are we working on things that will be able to, bolster the ability? Where do you want to be in a month and even 2 months from now?
Yeah. So right now, our testing capacity, we're up above 5,000, the capacity for 5,000 tests a day. And unfortunately, as we ramped up capacity, we're actually seeing things go the other direction, in that people actually getting tested, those numbers were going down. Now, part of that's good news, is we're seeing fewer flu-like symptoms as we move out of flu season. And as people have been isolated, it's actually brought down the disease and other like diseases, colds and flus, that would normally send people to get tested. So that's all positive news, but we need robust testing. We need more people to get tested so we can figure out where the disease is, and try to stop it in its tracks. And the good news is last week we changed the testing criteria. Now, if you have any one of 6 symptoms, you can get tested, no matter how mild. The new symptoms that we've added are loss of sense of taste or smell, muscle aches, or sore throat. So getting those 3 added allowed more people to get tested, and we saw those numbers come up. We had a couple days now where we've had over 4,000 people actually get tested. So those are really good numbers. And also, our infection rate has stayed at about 5% of overall tests, which is a really, really positive number. All of these things are great. Now, one of my worries is that we have testing in rural Utah, where I live. I live 100 miles away from here, and in places like Grand County, we don't want major hotspots there there that we're unable to find. So we started ramping up some mobile sites. We sent one down actually to San Juan County, down to the reservation where they've seen a significant outbreak, and we're doing more to increase that. So to answer your question, where do we want to be a month from now and 2 months from now? We're very happy with the trajectory of our kind of regular testing capacity, the swabs and the way we do that. We want rapid testing increased significantly. We just met with the federal government today to talk about where that's headed. The machines, we actually have the machines. There's just no testing kits. They're trying to ramp up production of those, and that will be huge for us. That will help us, especially with the most vulnerable populations. We'll be able to test frontline workers. These are 5-minute tests, 10-minute tests. You get the answers back immediately, to allow people online, especially healthcare workers, to keep going. Allow us to take it to our vulnerable populations, our long-term care facilities. What we do know is this disease is just disastrous for long-term care facilities, nursing homes, things like that. Of course, our homeless community as well, so that we can have those rapid and mobile testing and get more people tested. And again, over time, ramp that up so that people that work in grocery stores and other places could get these tests regularly, and make sure that we're keeping them safe. And then the third area is the serology testing, and these are the antibody tests. It's a blood test that lets us know who's actually had the disease, and that's something that shows up later. A blood test at the onset of symptoms wouldn't show that. You have to have the kind of original test to test for the virus, but after a few days, as your body starts to fight back and make those antibodies, and as we know that many people who have this are asymptomatic, may never know that they've had it until they've had a serology test. And so that would allow us to know who has had it, who has built up some sort of immunity, who can go back to kind of regular life without having to worry about distancing or some of the hygiene steps that are taken. So those are the three major areas. And as part of that, we will be launching, now that we have additional testing capacity, we can actually do some sentinel or surveillance testing. This is randomized testing. We're standing up a program with the University of Utah to test 12,000 people to see if they have it or if they have had it, as they do have some serology testing available at the University of Utah now, and do that throughout the state of Utah to get a better feel for what's actually been happening over the last 2 months, above and beyond what we're testing and knowing. So those are big issues, but they're really important for our plan moving forward.
Specifically with tourism, this is a really concerning thing for a lot of local businesses, because it's like, if people are getting turned off to traveling because of a pandemic and are trying to find other ways to vacation or whatever, that'll be really bad for Moab. So how do you think this is going to affect Utah and Grant County and Moab in the years or even months just to come?
Well, I wish I had a crystal ball and could see the future a little better. But what I can tell you is we've worked with experts from across the state and across the world, and talked through some of these things. I think there are a few things that are clear. One is that this has changed the world forever, and much like the major events in the past. Sometimes when you're in the middle of those events, we may not see the depth and breadth of it, but certainly we do believe that this has changed the course of history in some positive ways, and of course in some very negative ways. Two, I do believe that as difficult and as dire as it looks, that I'm betting on innovation, and there is so much at stake in this world, and so many incredible minds that are working to solve this, that I really do believe that we will see antivirals and medications coming online over the next few weeks, certainly in the next couple months, that will have an impact on this disease and save lives. And if we can even do that, short of a vaccine, that would be enough to allow many of us to go back, as long as we can cut down on people dying and people being hospitalized. And so the using that technology and those advancements is going to be very important for us. And then, of course, ultimately having a vaccine, hopefully in the next year, maybe year and a half, that will really change everything. Now, specific to tourism, my hope is that this will actually, there will be so much pent-up demand and desire to get back out and experience what we've missed, exist over this time, that it won't keep people back, that we won't have a fear of going out. Again, assuming we can instill confidence in the public that we're cleaning common surfaces and we're making it safer. We're wearing masks in the interim, and then we have these medical interventions. And I can tell you, I will be one of the first ones to get down to Moab. There are two places where I worship. I worship at my church on Sunday with my fellow congregants. I haven't been able to do that for a while. And Delicate Arch is my other spiritual place. And there's just something magical about rounding that corner and seeing that again. And I've missed it, and I can't wait to get back to it. And I know that there are people all over this world who need that opportunity again to commune with Mother Nature, and to see the grandeur of what makes us feel so small and yet so significant all at once. And so I'm really looking forward to that. And what I can tell you is, as a state, we are going to do everything we can to bring those tourists back here. And I think one way we do that is by being one of the best states when it comes to testing and lowering that curve and mortality rates and all of those things that we're seeing right now. That will instill confidence in people that this is worth coming back to.
I want to respect your time, so I'll just leave it to whatever you want to add or emphasize from what we've talked about. If we didn't cover something that you want to add, any parting words that you have, and then you can go ahead with your.
Well, yeah, thank you, and thanks for the interview. I would just say this: look, this, as I mentioned before, this is a global pandemic, and every country and every state is being impacted significantly. There's nowhere in the world I would rather live right now than here in the state of Utah. And what we've seen out of the people here, their willingness to step up voluntarily many times and take care of their neighbors, take care of each other, make sacrifices that hurt us personally, but benefit everyone by staying home. At the risk of enormous economic impact has truly been inspiring, and that's how I look at it. I also say that there was no state that is better equipped to come out of this than the state of Utah. We led the nation in private sector job growth over the last 10 years. We had the lowest unemployment in the nation and in our state's history, and those fundamentals were strong until this happened. And so there's no reason, although it will be difficult and it's going to take a lot of time, there is no reason that we can't move through this. And we will start to see economic activity increasing very soon over the next couple of weeks. We'll be extremely cautious. We'll do it together. We'll all make sure that we're washing our hands more, that we're staying 6 feet away from people, that we're wearing masks whenever we have to be in public. And that's going to allow us to bring some jobs back without hurting people. And that's where we need to go until we can get a fix for this.
Lieutenant Governor Cox, I really appreciate your time, and good luck. Stay safe.
Thank you. You too. Take care.